So our commitment throughout the pandemic has been to follow the guidance of our public health officials. That's how we've historically always run our school district, in the interest of our students, our staffs, and our families' well-being and safety. And that's always been our steadfast approach, and we're going to continue to do that. Our teachers and our staff have been incredible partners throughout this process and have walked with us hand in hand as we have received that guidance from our public health officials and put it into action. That has us returning all of our students to some form of in-person instruction by March 1st. We've had kids receiving in-person instruction, and school has been open since the first day of school in September. It's looked a little bit different, certainly, and we're eager to continue to return kids to more and more in-person instruction as our health officials deem it necessary and safe to do so.
I have kind of a two-part question here as we talk about, obviously you said the plan is to get as many kids back in the classroom as possible by that March 1st deadline. I'm curious if is there anything about the governor's announcement today that will change that could make that even faster, or perhaps get more kids back in there on a more permanent basis?
Yeah, so the governor's announcement about testing, we've been testing our students. We were one of the few districts in the state of Washington selected as part of that pilot. It started in January. We've tested approximately 1,000 students and staff members with that program. And it's really a layering of additional mitigation strategies: wearing a mask, social distancing, quarantining, aggressively cleaning, integrating testing. Those are all layering of mitigation strategies to continue to enhance the safety of our students, particularly as we bring more students back and as we bring our secondary students into our buildings. The structure of their day looks a little bit different than elementary, and so we're going to continue to work on implementing those strategies as best we can, and we're glad to hear that other school districts will be able to utilize testing in the same manner that Spokane has.
Knowing that you were one of 10 districts, SPS was one of 10 when this pilot program first started to get that in-school testing. Now 50 more districts are going to be a part of it. What about that program enabled SPS to really hold on to that data, and what did it teach you? What did you learn that could now help other districts get more kids back into the classroom even faster?
Well, it really supports the efficiency of getting testing done. And we know that testing is a key mitigation strategy that not only supports the individual who's confirmed positive to make sure they get the care that they need, but it also is a significant aid in contact tracing. And contact tracing is critical in reopening our schools. If you're not able to effectively contact trace and you're not able to identify an epidemiological link to your confirmed positive cases, then your rate of transmission in your schools that you report is not a valid number. And in Spokane Public Schools, we have been committed to ensuring that our contact tracing effectiveness has been 100%. It's maintained that number. Our team has worked very hard to ensure that we understand and we identify where transmission has occurred, so that we know when we share what our transmission rate is, we know that's an accurate number. And we're glad that other school districts will have additional tools and resources, testing being one of them, to ensure that they're also able to contact trace with that level of effectiveness. We know that's going to become increasingly important as you bring more students into your buildings.
So if if testing was the answer all along, then in retrospect, should we have started that back in the fall and gotten kids back into school earlier?
So we've not heard that testing is the #1 primary mitigation factor. What we've heard from our public health officials is that it's a layering of mitigation factors: wearing a mask, utilizing testing. Testing has been available in our community for some time throughout the pandemic. What school-based testing provides is that efficiency, that you can offer that service to our families. They don't have to go out to a clinic or to a community access point in order to utilize that level of reporting and, again, to aid that contact tracing. So we're glad that we were selected for that pilot. We're glad that we were able to be supported and get the availability of those testing, and I'm glad to hear that that is going to be available to more school districts.
Well, Dr. Swinyard, thank you so much for joining us. I'm sure there's a lot of relieved parents out there, and we appreciate you taking time to talk to us today.
Stay with us, everyone. We'll be right back.